Mommy makeover. What is this procedure? Who can relate to this or undergo the procedure? What is the right time to undergo the procedure? And how can you expect the flow of the surgery, recovery, so forth and so on? Let's discuss about everything about mommy makeover today and clear all your myths and doubts. I am Dr. Smriti Nathani, plastic surgeon at Tamira Plastic Surgery, Chennai. As we know, mommy makeover is something which women undergo after 1 or 2 pregnancies. Why is this procedure important and why do women undergo this? Because after a woman's body goes through the childbirth process, there are so many changes which happen in the body due to the hormonal interference and due to the expansion of the abdominal wall and everything, and the changes which happen in the body. So the body becomes loose, lax, and the woman feels that they are not same as they were before pregnancy. Why is it important? It is important for 2 reasons. Foremost is the confidence. Motherhood is very important to everybody and it is a very emotional connect. But it doesn't mean that in the process of going through the motherhood, you lose yourself. So it is important to gain back that confidence. Women should be able to wear the same dresses they were wearing before, and the laxity of the pelvic floor, of the vagina, of the breast should go back to the pre-pregnancy state. Second reason, as I told, the breast laxity. The breast becomes heavy, deflated. That cause problems like shoulder pain, back pain, postural problems. The rectus diastasis, the muscles in the front of the abdomen, they separate due to the pressure of the baby from inside. To align those muscles anatomically again to prevent, very importantly, the back pain after the motherhood, and to prevent the pelvic floor from problems like descent of the organs, stress urinary incontinence, vaginal laxity, etc. Not to mention the paunch that never goes back after the pregnancy and women still look pregnant. How do we go about it? So when a woman comes to us for a mommy makeover surgery to inquire about it, first thing is to ascertain what are the components of the surgery they require or they feel that they need. So that involves the very detailed clinical discussion among the surgeon and the patient, understanding their needs, and we evaluate the body that what procedures will be helpful for them. Mommy makeover is a conglomeration of 3 to 4 procedures, namely breast transformation. It can be breast augmentation or reduction, or just a mastopexy, which is a breast lift. Second comes the rectus diastasis. So the repairing of the rectus, repairing of the hernia if it has come during the process of childbirth, addressing the loose tissue in the abdomen, addressing small pockets of fat in the hips or otherwise which accumulate during the entire process of pregnancy. Fourth comes the vaginal rejuvenation surgeries. Depending upon what the patient wants and they need, we take a clinical examination and evaluate them and formulate a plan for them. Now, can the surgeries be done together? Yes, 1 or more surgeries can be planned together based upon the patient's general condition, comorbidities, etc. After the clinical diagnosis and a plan is made, there is a comprehensive lab investigations and the anesthesia checkup, pre-anesthetist checkup to evaluate and rule out any complications that may happen during the surgery, and that the patient is safe to undergo surgery without any unforeseen complications. After the surgery, or rather on the day of the surgery can last from up to 3 to 5 hours depending upon how many procedures we are doing. Patient will require 1 or 2 days of hospital admission. There can be drains which will be removed on the second day. Stitches usually are put which are absorbable stitches which need not be removed. They absorb on their own over the period of time. After the surgery, they can be discharged on the post-op day 2nd. We usually evaluate the patient again on 5th to 7th day to ascertain the stitch line, the suture line, and the other problems. Lymphatic massage is very important after any cosmetic surgery to make sure that the swelling is less and the pain is less and the patient is more comfortable, which is started usually during 3rd to 4th day of the surgery. By the end of week 1 and starting of the week 2, patient is completely mobilized. She is safe and comfortable to walk around, do a little bit of household help or work. From the end of the second week, they are okay to do any desk job, not a extensive job of, if they are working, but a desk job should be fine. From third to fourth week onwards, they can return to work very well without any discomfort. If we have repaired a hernia or a diastasis recti, they can resume their gym activities and weightlifting from sixth week onwards. By the third month approaches, they can see a very effective result by the end of the third month, and they are free to do any activities they desire. So that is a comprehensive but short timeline of how the mommy makeover procedure is done at Tamira, and we ensure that our expert team of surgeons and anesthetists and with the staff, the patient is most comfortable and they can undergo this procedure with minimum of the complaint, minimum hassles and comfortably. So if you are the one who are thinking of mommy makeover procedure, or you think that maybe this will help or not, you can reach out to us and we will be very happy to help you out. Kindly DM any comments if you have or any queries if you have, and don't forget to like, subscribe and share the video. Thank you so much.